Hello and welcome to our channel. If you're considering intrauterine insemination (IUI) as a path to parenthood, you might be wondering what tests and procedures are typically performed to ensure the treatment is appropriate and to maximize the chances of success. 1. Medical history and physical examination. Discuss medical history, menstrual cycle regularity, past pregnancies, and any current medications or health conditions. And its purpose is to assess overall health, identify any potential issues that could affect fertility, and tailor the IUI treatment plan. 2. Ovulation Assessment. Tests, Ovulation Tracking monitoring, basal body temperature, BBT, using ovulation predictor kits, OPKs, or tracking changes in cervical mucus. Ultrasound, to observe follicle development and confirm ovulation, and its purpose is to ensure ovulation is occurring and to time the IUI procedure correctly. 3. Semen analysis. Tests, sperm count and quality, assess sperm concentration, motility, morphology, and overall health. The purpose is to evaluate the male partner's sperm health and determine if IUI is an appropriate option. 4. Hormone testing. Tests, blood tests, measure levels of hormones such as follicle-stimulating hormone, FSH, luteinizing hormone, LH, estradiol, and progesterone. Its purpose is to assess ovarian reserve, check for hormonal imbalances, and evaluate ovarian function. 5. Ovarian reserve testing. Tests, anti-Mullerian hormone, AMH test, measures the level of AMH in the blood to evaluate ovarian reserve. Antral follicle count, AFC, performed via ultrasound to count the number of follicles present in the ovaries. By those tests, we can determine the number and quality of eggs available. 6. Uterine evaluation. Tests, hysterosalpingography, HSG, an X-ray procedure where a contrast dye is injected into the uterus to check for blockages in the fallopian tubes and evaluate the uterine cavity. Sonohysterography, saline infusion sonography, an ultrasound procedure where saline is injected into the uterus to provide a clearer view of the uterine lining and detect abnormalities. Hysteroscopy, a direct visual examination of the uterus using a thin, lighted tube inserted through the cervix. The purpose is to identify any structural issues within the uterus or fallopian tubes that could affect the success of IUI. 7. Cervical evaluation. Tests, cervical mucus assessment, evaluates the quality of cervical mucus and its ability to facilitate sperm movement. Cervical smear or Pap test, to check for any cervical abnormalities. The purpose is to ensure the cervical environment is conducive to sperm passage and fertilization. 8. Genetic testing, if indicated. Tests, karyotyping, to check for chromosomal abnormalities. Genetic screening, for inherited conditions that could affect fertility or pregnancy. Its purpose is to identify any genetic factors that could influence fertility or the likelihood of successful pregnancy. 9. Infectious disease screening. Tests, blood tests, screen for sexually transmitted infections, STIs, HIV, hepatitis B, and hepatitis C. Purpose is to ensure there are no infections that could affect fertility or be transmitted to the partner or future baby. Thanks for watching. Don't forget to like, subscribe, and hit the bell icon for more updates.